Welcome to the Senior Hour, which is sponsored by Providence Holy Cross Medical Center and Comfort Keepers in Home Care. I'm Barbara Cochran with my co-host,
Dr. Thomas Polucki.
On your hometown station, 98.1 FM, AM 1220 KHTS. This is a show for, about, and by seniors, giving information to enhance one's quality of life. And speaking of quality of life, we have a hospital, Henry Mayo Hospital representative today, Jennifer Whitcomb. Hi, it's good to see you again.
It's good to see you.
It's been a long time.
It's been since last February.
Whoa. So what's on the agenda for the day?
We have a lot of growing programs, a lot of new technology that we've introduced since last year, and it's also Atrial Fibrillation Month. So it's good to talk about A-fib awareness.
Okay, so explain those two words.
Atrial fibrillation,
yes,
or what we call A-fib. It's the most common cardiac arrhythmia that's diagnosed in the United States currently. It's when your two top chambers, your atrium, don't communicate with your two bottom ventricle chambers. And what happens is the atrium kind of fibrillates like this instead of pumping. And when that happens, blood pools in those two chambers. And when the risk of that is that clots form. And when the heart pumps, you're at risk for the clots to go into your brain and cause a stroke.
Oh, whoa. That doesn't sound pleasant at all. So what is an age group for this to happen, or is there an age group?
Absolutely. Middle-aged to elderly, more common in men than women.
Really?
More common in European ascent than anything else.
Uh-oh.
That's a lot of us.
Do you see the demographics changing in that at all, or have they been pretty steady even over the past 4 years?
It's pretty steady. However, lifestyle, the kind of the unhealthier lifestyle we lead, the AFib is definitely more common.
Okay, so let's talk about it a little bit. AFib Awareness Month. So you're now talking my language, the lifestyle, right? Instead of just, oh, they need a pacemaker, or they need to be on these medications. You said it first, so I get to play with that a little bit. What are some lifestyle medicine practices that people can avoid a trip to the ER?
Well, first and foremost, AFib cannot go untreated. You absolutely have to have medical treatment for it because there's such a high risk of stroke. But lifestyle modifications, just like anything else, exercise, diet, limiting caffeine is an important one. Lowering your stress. Anything stressful, it can trigger episodes of atrial fibrillation.
Easier said than done.
Absolutely.
Okay. So yeah, that's more of my show than yours as far as better equipping yourself to deal with stress, because there's no such thing as lowering stress. So okay. Besides it being 9/11, I almost forgot.
It's all over.
Pun intended.
Turn the radio on, the TV on, it's all over the news.
It's AFib Awareness Month, but you're here to talk about some special stuff going on at Henry Mayo in your department, the cath lab.
Yeah.
So let's talk about that a little bit.
We've had a year of extreme growth in our cath lab. We brought on 2 new physicians. In the past fiscal year, we've had a 56% increase in volume. So we've almost doubled our volume. We are growing faster than our means. We are looking at expansion at this point, and we're just bringing in new technology one after another. Our main goal is to, like I said last February, is to not have our community have to go outside their community for any of their cardiac healthcare needs. So I'm always looking to bring any new technology into our program.
So we're talking about 2 today, yes? The core flow, is that right? So that's a whole system. It's not just a procedure, yes? Like there's the diagnostic component of it, the treatment component of it. So can you talk a little bit about that?
So the core flow is a what we call a pressure wire that you insert into the coronary arteries. And its indication is for when patients come in and they have chest pain, ongoing chest pain, and their coronary arteries are clear. And we don't see any coronary disease. And previously we would just say, well, go see a pulmonologist, go see a GI doctor. But as we know, or as I know, and now you will know, 90% of the blood flow actually does not come from the main 3 coronary arteries. 90% of the blood flow to the wall of the heart comes from the microvasculature. So the teeny little vessels that come off the coronaries are actually feeding the myocardium or the heart muscle most. So what we've learned is that there's like a 60% chance that these patients that have clear coronaries actually have disease in their microvasculature that's causing this angina. So this wire can help us diagnose so we can medically treat these patients. So we can get a definitive diagnosis where previously we couldn't do that.
Gotcha. And all right, so I kind of understood what you said, so I can guarantee that most people
it's
you lost it. A wire, what? With a wire, you see what and how? And okay, so there's a couple of main arteries that feed the muscle that pumps blood through our body, pumps it into our lungs first, and then it comes back from the lungs and supercharged with oxygen and pushes it out to the brain, to everything in your body, head to toe. And it's pretty common knowledge that there's the big ones out there. There's the widowmaker, right? The one that goes down to the ventricle that if that goes, you're going to have a really bad day. But what you're saying is that that's only 10% of the problem.
Correct.
90% of what keeps your heart healthy doesn't show up on one of those angiograms, which has up until this point kind of been the gold standard. Yes, no, maybe?
Yes.
All right. So the main diagnostic test that people are told, okay, you're in good shape, we can't find anything, you got to go somewhere else, is wrong 90% of the time?
No, it's 90. No, I'm not saying you have disease in your microvascular 90% of the time. 90% of the blood flow to the muscle of the heart comes from these vessels, whether
Gotcha.
they're diseased or not.
I gotcha.
90% of the blood flow, where only 10% of the feeding of the blood to the muscle of the heart comes from the main 3 coronary arteries.
I gotcha. Okay.
Well,
so
you were talking about a wire.
yeah.
So the
What kind
CoraFlow, the CoraFlow is a wire that goes down the coronary artery, and it detects the disease in the microvasculature.
Okay, so that's something that you would apply. You would use this wire
Correct.
for the determination.
Correct. So when a
I
patient
see.
comes in and with chest pain, and we do an angiogram, which is when we inject the contrast into the
Right.
coronary arteries, and we don't see any blockages, then that's where the indication is for this CoraFlow microvascular wire to rule out disease in the microvasculature.
So it is literally a wire that
Correct.
you're talking about. Inserted in the thigh, you go up the femoral, or okay. So similar to like an angioplasty, because we're going to get into the medicated balloon as well, right?
Correct.
So similar to an angioplasty, you go in, they go in through your thigh, snake a wire up there into the heart, and start taking readings. What is that about?
So the wire sits in one of the coronary arteries, one of the main coronary arteries, and it through a very technical process, it creates a measurement, an index. We call it an index. It's a measurement, and depending on what that index is, that's positive for microvascular disease or negative. And we can't do any intervention right then for that. We can just medically manage it.
Gotcha.
But it gives us that definitive diagnosis,
Yeah.
so we can medically manage it, where we couldn't do that before.
Yeah, well, knowing is a good first step.
And this is
it does-
very common in females. And that's kind of why that was one of the incentives to bring it into our community, because we really are starting to focus on female cardiac disease.
Gotcha.
Well, now, can you tell if someone has a cardiac disease if they have a CAT scan or an MRI?
You can. There's a coronary CTA, we call it. It's a CAT scan. We do a calcium scoring, which high calcification usually shows that there's coronary disease. So yes, both can detect coronary disease.
Interesting, because I'm having CAT scan tomorrow.
Mm-hmm.
It's it's a 6-month one I have now because of the 2 cancers I've had and beaten. And every 6 months now I have to go in for a CAT scan to see if everything is clear. So hopefully it's still clear.
Yes.
Okay. So typically, does someone come to you if there's a history of chest pain, there's a history of heart disease in the family, there's a history, they know there's something wrong, or is this more of a general screening population to make sure that you don't get there?
It can be both. Patients that are symptomatic are the highest population because, if there's no disease in their coronaries, we want to rule out the microvasculature. Sometimes with a strong family history, we will electively bring them in.
Yeah.
But this is done on a inpatient and outpatient basis.
Yeah, because one way or another, coronary vascular disease is still the heavyweight champion of what's going to give people a real bad day.
Correct.
Now,
So-
is this something that's inherited?
It can be. Genetics can play a large role in coronary disease. Usually, how we measure it is the younger onset of coronary disease, usually around 55. That's a genetic component. So the younger coronary disease are most likely genetic.
Oh, interesting, because both of my parents passed away from heart attacks. And
Well, you've beaten the
far,
odds.
I guess I have, because I've outlived them. They both passed away when they were 70,
Yeah.
and I'm getting close to 90. Oh.
So you did mention that there are demographics in this. There are specific patient types that this is a more appropriate, if not first step, next step. It's never a first step, is it?
No.
Okay, so when all of the indicators don't show up that, oh, well, this is obviously heart disease. This is, you have a blockage of this one or that one, or you've got A-fib or whatever, but you still know there's something wrong. This would be the next step. And it's appropriate in more, did you say women? More women?
Microvascular disease is more prevalent in women. Women historically have a more difficult time being diagnosed with cardiac disease. They have vague symptoms. They tend to kind of ignore symptoms more than men. They present with, pressure and GI symptoms and heartburn and, all kinds of vague things. So historically, they've been told, it's anxiety, it's stress, it's this, it's that, it's asthma, But now we can actually get a definitive diagnosis for these females.
Which could be contributing to all of those other conditions. So they stop at that level of treating the symptom, like, oh, I have heartburn. Oh, well, here's just take
Right.
an acid blocker, right?
That's what
Instead
happened
of-
to me in the middle of the night
Yeah.
last night.
Instead of going in and saying, oh, well, coronary disease shows up like that, right? So maybe we should take a look.
Yeah, it's important because it increases quality of life
Sure.
to get this diagnosis, and it also reduces emergency department visits and readmissions, which is very important for our hospital.
Yeah, big, expensive e-ticket ride there.
Expensive, and we are very busy and full.
Sure.
So it's, beds are tough.
Yeah. Okay. All right. So let's talk about the other technology that you're here to discuss, and that is by now I think most people are aware that there's something called balloon angioplasty, right? But there are sometimes some complications with that procedure that people want to try to avoid. Some people want to try to avoid getting a metallic stent put in place, only because the track record warrants it. Tell us about the difference in this new technique for balloon angioplasty.
So the new technology is called a drug-coated balloon. What it's indicated for, so let me go back. And when we have a blockage in the heart and we put a stent in, the stent is a metal stent, and it's coated with a drug. And what the drug does is it prevents clots from forming within that stent within the first few months. Because when you put a foreign object in your body naturally wants to fight it and wants to attack
Absolutely.
it, and clots form. And in the coronary arteries, when a clot forms, that's an acute heart attack. So that's what we want to avoid. So when we first put that stent in, it has the drug coating that helps the stent stay open. And then you're on blood thinners for the first few months to prevent the clotting. And then after studies show even as low as 6 weeks, the stent naturally becomes a part of the coronary artery. It what we call endothelializes, meaning the tissue grows around it. It's no longer a foreign object. So then you can come off the blood thinners at that point. So we've had that technology for a long time for stents, but we've never had that for the angioplasty balloon. And the angioplasty balloon is what we put in the blockage before the stent in order to open it up enough to get the stent through. So it's just a balloon that gets inflated across the blockage in order to kind of smack it open so we can get a stent in there. But historically, we haven't had any drug-coated balloons. And the indication for the drug-coated balloons is when we have a stent that after time it becomes blocked. So we call it in-stent restenosis, meaning it narrows again after the stent's placed. You don't want to keep placing stents in stents in stents because that's just more stuff to cause blockages, and it narrows the vessel. So now they came out with a drug-coated balloon, which you can go in a stent where it's blocked again, and you can open it with angioplasty, but it stays open longer because of that drug coating. So it's a great technology. We were really lucky at Henry Mayo to be offered this technology from Boston Scientific as one of the first in Los Angeles County. So we introduced it a few weeks ago, and they trialed it at Cedars-Sinai, but we were the first hospital to use it. So it was really exciting for us. We do get quite a bit of in-stent restenosis, so it's a great technology.
Okay,
So you had patients that could test it for you
Yeah.
and make sure that it works and how it works.
It's been FDA approved recently, and there's great studies out there. So we were very confident in its use. And yes, we immediately had a handful of patients right away that we used it on.
Wow. That's fantastic.
yeah, so just to make it clear, this procedure has a better outcome than trying to redo a stent. And that's why it's there, right?
Correct.
That's why the technology was created in the first place. And you said there was a study at Cedars, or
They trialed this technology.
they
at Cedars,
trialed it.
Yeah.
So the outcomes there
Yep.
warranted that, we want that. Yeah.
Yep.
Okay. And it's only a few weeks here at Henry Mayo, but
Correct.
it seems to be working
Yeah,
out great
it's
for
great.
you.
We've used it quite a bit.
Better than doing the more invasive procedure of replacing a stent.
Yeah, so when you put a stent in, it's for life. It becomes an actual part of your coronary artery, so you can never remove that stent. So the only way previously to help with in-stent restenosis, or when a blockage occurs in a stent, is to place another stent. And we've done that. We've done stents and stents, but really that's where it ends. You can't really go any further than one
Right.
stent and a stent, because each time you place it, there's more material in there, and it just narrows the artery even further.
Yeah. So this is a much better option.
Yes, it is.
Much better option, because it sounds like you've only got 2 shots at that, and then you're kind of out of luck.
Yep.
Yeah. Okay. So that sounds good. Anything else on the horizon? Anything that you're looking forward to on the horizon that's coming down the pike and going to change stuff for you and
Yeah,
everybody?
we do have multiple technologies coming down the pipeline. One of them is to treat acute anterior MI heart attacks, which is the Widowmaker.
Yeah.
And it injects supersaturated oxygen to the heart wall, which helps reverse ischemia, or lack of blood flow immediately. Helps the heart heal immediately. And that's coming down the pipeline. And then just expansion with all of our growth.
Sure. Awesome. Jen, thank you so much for your time. I appreciate it, and giving us that kind of information on this format. I think it's a great service to the community, so thank you for your service. And I hope nobody has to see you over
That would
at
please you tremendously. I'm
over at
sure.
Henry Mayo. Thank you. When we get back, we're going to shift gears a little bit. So specifically, a great tie-in with 9/11. We're going to be talking to a couple people about a fundraiser for I forgot.
Veterans.
For veterans, yes. 9/11, never forget, right? Okay. It's a running joke. When we get back, you've been listening to the Senior Hour at KHTS FM 98.1 AM 1220 hometownstation.com.
Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Dr. Thomas Polucki, on your hometown station, 98.1 FM, AM 1220 KHTS. And our guest now is Jimmy McCoy with the JCI Veterans Resource.
Hi, thanks for having me.
Yes, good to see you again.
Yeah,
it's
it's good to be back.
Long time.
Yeah, a full calendar year.
Wonderful.
Every year around this time, at least for last year and this year, we've had you come in and talk about what JCI is doing for veterans. And I'd like to know, it's not this weekend, but next weekend, yes?
That's correct, yeah. It will be on September 21st at William S. Hart Park from 10 to 1.
Okay, so it's at Hart Park, 10 to 1, not this coming Saturday, but the following one. What's the date on that?
It's the 21st.
The 21st, okay.
Yeah, so
9/21, 10 to 1, Hart Park, services for veterans. And we got a lot of veterans here. So you're providing a valuable service. Can you go into a little bit about what kind of services will be there for the vets?
Yeah, absolutely. So Junior Chamber International has worked very diligently to partner with several community partners to put resources into the hands of veterans and their family members. So some of those services that we're looking to partner them with include education services through College of the Canyons, mental health services like Blue Star Mothers. We're going to have the Veteran Affairs out there as well, a couple of veteran service officers to help them with the process of initiating or filing for claim increases, and many more services beyond that. We've gone so far as also to partner with, the local Cub Scouts so that we can keep them feeling young while they're out there and give them reasons to smile other than maybe the free lunch that we're serving. So.
Okay, great. So walk me through it. So there's, I know there was a veterans collaborative. Do you work with them at all or no?
We do. They'll be there.
Okay, so the
Yes.
veterans collaborative will be there, and I know there are VA. Is it advocates? What? I know there's like somebody who is your intermediary when you need to get to the VA in a local area. You know what I'm talking about? So how is the VA represented at your event? Let's just start there.
Usually the Veteran Affairs organization will send a representative to pass out some pamphlets and to talk about VA services that a prior service member or an active duty or reservist might be entitled to given their time in service. It's usually just the one person, but we bring out additional personnel called veteran service officers. Some of them do work for or with the VA directly, but by and large, these are community members who have taken it upon themselves to become experts in the field. They understand the ins and outs of what it takes to file a claim, to get an appropriate rating based on that service member's needs and what's articulated in their medical file.
Mm-hmm. And which VA hub are they associated with? Because I know there's the one down, what is it?
Sepulveda.
Wilshire. Yeah, Sepulveda. Sepulveda. And then there's one up in Lancaster. So who's...
Well, it depends on which VSOs have volunteered for the weekend, where we're going to pull them from. But we do pull them from our surrounding areas. So we might have individuals come from Oxnard, from Lancaster, from Sepulveda site. We also have community members who have been doing this for some time and have already partnered with the collaborative, for example. So it's whoever's volunteering their time that day.
That's awesome.
Well, we have a Veterans Collaborative here.
Yeah,
We
yeah.
have an
Yeah,
office
and they're going to
here.
be present.
Oh, good.
Got it.
Good,
And
good.
so what is someone expect? So this is predominantly a resource event for veterans, right? That's what this is for.
Yes, it
it's
is.
not for the general public to.
No, but they're more than welcome to come by and share their support for the servicemen and women of our country who've, paid their dues, so to speak. And if I can, let me just give you a little bit of background. So I'm a Marine Corps veteran. I did 5 years active duty. I served 2 tours in Iraq. And when I got out, at the time, I felt relatively well. But as time went on, that definitely changed for me.
Yeah.
And a lot of service members are finding themselves in this same predicament where months and years after the fact, the onset of the problems begin. And a lot of times the research is slow to catch up to what's actually occurring. But many of us who served in the Gulf War, for example, or in the Gulf, have what's now been dubbed Gulf War syndrome. And so there are a laundry list of conditions which are just considered presumptive. If
Right.
you served in this area, chances are you have this condition.
Yeah.
But the average service member, when they get out, they're not educated on this. And I wasn't at the time, nor was my wife. And thank goodness she's as supportive as she is. The two of us essentially put our brains together and had to become kind of research analysts and private investigators to figure out what benefits and entitlements I could get for our family.
So, what was your condition when you left the service?
When I left, my initial filing was just for migraines. And I
Migraine
received
headaches.
a 0% rating on that, which means they established that, yes, it is considered a disability, but I would be entitled to 0% compensation for it. So here we are. I've been out of the service for nearly 20 years now, and I'm 100% permanently and totally disabled according to the VA, which means for the rest of my life I will receive financial benefits and many other compensations. The disabilities are never going away. And it's something that impacts my life on a daily basis. And if I had not taken the time to go through the research like I have, I wouldn't have known that I could file for these things. And so I would be having to call out of work, for example, because of a debilitating migraine, and that would be loss of paycheck to me,
Right.
and that would be loss of cost of living and allowances and things like that for my family. So we put on the Veteran Resource Fair, JCI Santa Clarita does, because there are service veterans who volunteer with our organization, and we've gone through this same process, and we want it to be easier for the next person up. It should not require extensive research to file for the benefits and entitlements that are owed to them, and we want to make sure that they have this quality of life adjustment that they're entitled to.
Yeah, it's
Wow.
it's hard. I mean, war is never a good thing. When you got to do it. By the way, thank you for your service.
Well, thanks for your tax dollars.
When you've got to do it and you're exposed to stuff, and then it's not just. It shouldn't be your responsibility to figure out that, hey, this is the problem. But a lot of times it is. The burden is on you. And not just to put the pieces together and figure it out on your own, but then to have it acknowledged that that is really what's going on. So can you walk us through that process, what your experience was like? Was it just okay, now we get it?
Yeah, I would love to do that because, again, this whole process and the point of the fair was to demystify this for the next person up. I had been going through a slew of conditions, and I have a blessing and a curse simultaneously, depending on who you ask, where any given day that I wake up, I can rationalize why I feel the way I do, and I can put it behind me the very next morning. It's a gift, but it's a curse because it meant that I wasn't logging the problems and I wasn't seeing the patterns. And that's where the veteran service officer really came in for me. I went into file because, again, the issues were kind of piling up and I couldn't quite explain them, and I just wanted to talk to somebody. And the veteran service officer, with all of their experience, was able to comb through my medical file and say, hey, I think you might have this. I'm going to send you some material. I want you to look it up and tell me whether or not you think this fits. And I remember sitting next to my wife as we scrolled through a couple of pages, a couple web pages based on the information the VSO sent. And she looked over at me and I was practically in tears, which, as a Marine is difficult to admit on the air maybe, but it was an aha moment to have a label put to something that I'd been feeling all along, and to feel in that moment like I was seen.
Well, now, was this because of your migraines?
Migraines plus. So,
and did you have these migraines constantly?
Yes, it's a constant experience for me. At the worst, I have a migraine at least once per week, sometimes for multiple days at a time. Oh. Migraines for me are absolutely debilitating. Dark room. I have to have it quiet. I often get very nauseous, watering eyes. I mean, it's terrible. And it's very difficult to function in our 9-to-5 economy when you carry that kind of condition. And so the VSO being able to help me identify that plus the other conditions, helping me understand the way that the rating system works so that I can do my best to articulate how I'm feeling on the worst of days is really also critically important, because if you are covered for the worst of times, then you know that when you're at your bottom level, you're still going to be taken care of. Mm-hmm. We have this habit of always saying, well, I'm okay today, or I'm fine, or, the next guy up has it worse than me, so I shouldn't, I should put my problems to the side because I got to think of the other guy. Now, the reality is, we have a multi-billion-dollar budget for the military-industrial complex, and the veterans served that. That budget also is allocated towards helping us with the healthcare expenses we have incurred as the result of being placed in these war zones. And we are doing ourselves and our families and often our communities or our employer a disservice by not filing for these benefits, because they're making sure that we show up at our best. Mm-hmm. And so that's the critical message that we've been pushing. And thankfully, Junior Chamber International, as an international organization, has given us a platform to do that and to help out our fellow man, because we believe that service to humanity is life's greatest work.
Yeah.
Absolutely. And service to the world in general. I mean.
Okay, so September 21st?
Yes, sir.
Yeah, September 21st, Hart Park, 10 to 1.
Right.
Services, veteran services related. So it is going to be, there will be a VSO there, a veteran services officer.
Yes.
So there'll be a VSO. The collaborative will be there. Who else is going to be there for our veterans who may not even know that these things are available? It's surprising that so many people just don't even know that this stuff exists.
Yeah. So I'll answer this question in two parts. First, part one is we've partnered with fantastic organizations. So Loan Depot is going to be out there to help talk about VA home loans and housing. Blue Star Ranch and Blue Star Mothers, they're going to be out there to talk about mental health services. And by the way, last year we had at least 3 veterans come onto site. We were able to give them mental health service support on the spot and set up recurring appointments for them thereafter. Wow. And we also we were able to get a homeless veteran housed. And I can't tell you just what that means to me.
Yeah, it's outstanding.
It's incredible. We're going to have organizations like College of the Canyons out there to talk about educational benefits. And by the way, it extends beyond just the GI Bill or the post 9/11 GI Bill. There's now also vocational rehab which, helps retrain service veterans in an occupation maybe that better meets their needs now that all of this time has passed since they've been out.
Like going to mechanic school and that kind of thing.
Right, because maybe you got your degree in something when you got out using your GI Bill, but now as your disabilities have piled on, maybe that position no longer is suitable for you and no
Right.
longer meets your needs. And so there's an excellent way to tap into your Evoke Rehab benefits and get that additional training in that new skill or trade. We're going to feed the veterans and their family members while they're there. The veterans are going to eat for free, but there'll be food purchasable for the family as well. And we're going to have the Cub Scouts out there, like I said, to keep things lively and interesting for everybody.
That'll be
So,
great. That'll be good for the kids too.
yeah, but
Very good.
the long story short is, again, we just want to make it easier for the next man up. So on the 21st, come on out from 10 to 1. We'd love to hear your story. We'd love to help put some resources in your hand. And we certainly want you to leave with a smile on your face, if nothing else, because the Scouts are going to be very entertaining. But, we like to swap stories and things like that and be true members of our community. So.
Yeah. So when you say we, you're talking about JCI, right?
Yes, as well as all of these partner organizations that are going to be out there, like the Guardians.
Okay. So
the
yeah.
Guardians are going to be there. Oh
Yeah.
yeah, they come on the show also.
So that's an important resource in
Yes.
and of itself. Everyone that you've
Absolutely.
told about is is going to be a great service that some people still don't know. Some people still don't even know about it, but we're trying to change that. And again, thank you for coming in and for all that you're doing. I believe that you're more inclined to become an expert at something when you have to go through it yourself. So thank you for your journey and where it's taken you and what you're doing in order to help the next guy make it a little bit easier for you.
Thank you. I appreciate that. Leading by example is what we are taught to do. JCI has given me the platform to do that, and I just want to make sure that I honor it.
Yeah, awesome. Thank you so much. Again, we'll talk a little bit more about that in just a minute. You're listening to the Senior Hour, KHTS FM 98.1, AM 1220, hometownstation.com.
I'm Barbara Cochran with my co-host, Dr. Thomas Polucki, on your hometown station, 98.1 FM, AM 1220 KHTS. And we're speaking with Jimmy McCoy, who is with the JCI Veterans Resource. And how did you get involved in the Marines?
Well, like most people, I think I had an option after high school, and not everybody can afford college.
That's very true.
Minimum wage at the time was only $5.75 an hour, and there was just no way that I was going to be able to meet my own goals working a minimum wage job. And so with no other, skills or knowledge, I had to make a choice. And, I was an art kid, so I knew that wasn't really going to bring in the dollars either. So why the Marines? Well, because when you take your ASVAB, recruiters, especially if you do well, they kind of swarm you. They all want your initial interest, and they're trying to make their quotas.
Okay, acronyms is Marine talk. So talk like a civilian for a second. When you take your exam for what?
It's called ASVAB. It's the Armed Services Vocational Aptitude Battery.
There you go.
And
That's a mouthful.
it
I can
really
see why you
is.
use it.
Yeah. No, definitely military world is just full of acronym soup. Sorry for that. But it's commonly known as the ASVAB. High school counselors know about it. I took my ASVAB. I did well. The recruiters, of course, were trying to push me one way or the other. But the Marine Corps recruiter, boy, he was persistent. He showed up every day. He conducted himself in a manner that was above reproach, which is what we're taught to do. And I allowed myself to be swayed by the idea that it was going to be transformational. And I'm glad I made that choice, because it absolutely was.
Yeah.
So, and you've had 2 tours?
Yes, I did. I did 2 tours in Iraq, one in 2007 and another in 2008, and that time in service is really invaluable for the life lessons it taught me. But of course, it wasn't without consequences. So,
No. And what were some of those consequences?
well, like I mentioned earlier, I am 100% permanently and totally disabled now. So there is that. And that's not just for physical health issues. There were mental issues there as well. Thankfully, I'm a well-adjusted civilian now. I've done the hard work of utilizing these benefits to receive mental health support and services, and I'm much more adjusted now for my family's sake than I would have been had I not had my family. I got out in 2010 when my oldest son was being born, because by then I had been shot at and mortared at, and I had done my tours, and I thought, my dad was in the military. He was deployed often. I know what it's like to grow up with a father who's in and out of the household. I think I'd rather just be around. And so that became the plan.
And you were feeling pretty good or functional when you got out, and this didn't show up until a little bit down the road?
Yeah, and the changes were almost so incremental and so small that, again, if I hadn't gone through the process of logging what was going on with me so I could see the patterns, I wouldn't have.
Yeah. Yeah, it's hard. And you're not equipped to deal with it. I don't believe that even most doctors are equipped to deal with it. So your journey is way too common. And thank you for sharing, and thank you for, again, your service, not just as a Marine, which is pretty outstanding, and going to war to protect our country and our interests, but your service after the fact of having to go through that kind of a hell and turning it around to help the next guy so he doesn't have to suffer the same way.
That's amazing, because there are so many veterans that are on the street.
Yeah. So real
Literally
quick,
on the street.
JCI is holding a service. What would you call it?
It's a
resource
fair.
A
Yeah.
resource fair.
Veterans
Thank you.
Resource
A
Fair.
resource fair for veterans, September 21st from 10 to 1 at Hart Park. Again, Jimmy McCoy, thank you so much for your time here and your service. You've been listening to the Senior Hour, KHTS, FM 98.1, AM 1220, hometownstation.com. We're brought to you by Comfort Keepers in Home Care and Providence Holy Cross. Now go out and enhance your quality of life.